Hi everyone, welcome to Coffee Break. It's Steve Barrett here, the editorial director at PR Week, and we're here this week with Jake Duhaime, who's the PR manager at Iovate Health Sciences International, based up in Boston. And Jake, welcome to the Coffee Break, and good to have you on the show.
Thank you, Steve. I appreciate the time.
Now, I guess we interacted because maybe you're not the massive fan of PR Week, or you think we're a bunch of woke liberals down in New York who don't give enough airspace to different opinions. So that's why we've got you on the show to talk specifically about, communication around COVID, around the vaccines, etc. But before we kick into that, just tell us a little bit about Iovate and the work you're doing up there in Boston.
Yeah, I would say I am a big fan of PR Week. I think it was more discouraged on the cheerleading that was the Vaccine Project newsletter, and not necessarily a realistic analysis of everything that's going on, especially tactically, where there's a lot to discuss. But Iovate is a company, a nutrition company that deals with a number of different supplements in the sports performance, healthy lifestyle, even the weight loss space with our HydroxyCup brand. We do a lot of work with athletes. We do a lot of work with reality TV stars. We do a lot of work in terms of having our products available wherever you can find them, whether it be a CVS, a Walmart, an Amazon. We're one of the biggest companies in the space with more than 2 decades of experience. And I think, again, the other point of frustration I think that came across was it wasn't just the kind of the blanket cheerleading, but some of the things that I face on a day-to-day basis have also created a lot of red flags in terms of my own confidence in what's going on around me.
And you have a background in sports PR as well, with I think the Women's National Hockey League and the
yes.
And also,
Yep, Detroit Red Wings, National Women's Hockey League. I worked at a sports agency for 3 years as well, and I've done a ton in the sports space. So, I think one of the things I was talking to you about was influencers, specifically athlete influencers, who have been among the most skeptical. And some of the very, very biggest names in our field are also the most hesitant to do this. And remember, these are people who have millions upon millions of dollars invested in their body, who literally need it in order to perform at the highest level. And it's a consumer that we talk to on a day-to-day basis, and a consumer that we're not seeing adapt as strongly as other sectors of the world to COVID-19 vaccines. And I think that, to me, raises a fair deal of red flags, either in terms of the stature of the athletes. We've had 2 MVPs. We've had Lamar Jackson and we've had LeBron James come out in the last couple of months and have either flat out denied getting a vaccine or been hesitant and ducked questions. We've seen some of the world's best golfers, Bryson DeChambeau and Jon Rahm. Bryson hasn't gotten the vaccine. Jon Rahm has gotten the vaccine and still tested positive after the fact. We saw the most famous franchise in American sport, the New York Yankees, have an outbreak with 5 vaccinated players 2 weeks before the Provincetown story came out. And I think that was more the reason why I was sitting here saying something doesn't pass the sniff test. If you're saying on July 1st, your language is breakthrough cases are extremely rare, and on August 1st, you have various members of government panicking because you had 4th of July celebrations in Provincetown, Massachusetts, among mostly vaccinated individuals, lead into a major outbreak. So there have been shifting communications here over the last year and a half, and I don't think that's helped. And then I think athletes are very authentic in terms of influencers and what they do. And I think it's worth asking questions as to why they're not on the bandwagon.
Yeah, they're definitely incredibly influential. And we've seen now, KD just won the Olympic gold medal, didn't he? So He's got an amazing platform there. Clearly, COVID in Japan was a big talking point because the Japanese population didn't really want the Olympics there because they didn't want the virus to spread in their country, which has been reasonably successful in keeping a lid on it. Do you think that a lot of the athletes come from Black and minority ethnic communities that have traditionally been suspicious of vaccines because of their experiences with the healthcare system? Do you think that it's an extension of that, because a lot of the sports stars you're talking about do come from those communities?
I think some of it is that, and then the other piece of it is athletes are extensively drug tested, and any slight sign of missing a drug test or failing a drug test reflects poorly on the athletes in terms of costing them at times hundreds of millions of dollars. If it's the right athlete in the wrong time and the wrong drug test, it could cost them their entire livelihood or career. So they have been conditioned, especially over the last 25 years, especially since incidents like Ben Johnson and Major League Baseball steroid scandals, to be very, very cognizant of what they put in their body. And I think even among athletes, you see a vast assumption of athletes still think like it's the 1980s in terms of they'll take anything as long as it can help them win. And what we found in our space is athletes are super paranoid about what they put in their body and they obsess over it. So I think that's a big part of it, as well as the first thing you mentioned, which is, of course, there is a racial component. And I think that does play into it to some degree. But, you know, to some extent, if you look at LASIK 20 years ago, the early adopters were all athletes. Tiger Woods got LASIK in 1999, won 4 majors in the next 15 months, and all of a sudden LASIK took off. Bernie Williams, who played for the Yankees in 2000, after his LASIK surgery, I think he improved his batting average by 30 points. So athletes will still do whatever it takes to their body to maintain that competitive edge. I think for them, like many of us, it's what are the long-term ramifications of this? Short-term, what does it mean? You know, the NFLPA had a situation last week where it said, you know, it tried to create 2 different sets of rules, one for vaccinated players, one for unvaccinated players. And vaccinated players wouldn't have to do things like be tested every day. And the hope was it would spur on members of that union to get vaccinated. Well, less than a week later, they switched and they did a 180 on that because of and using the Delta variant as their cover, they now still want players to test every single day. So the communication has been awful across the board, but specifically in terms of athletes, if you dangled the right carrot in front of athletes, I still think they would jump at it. It's still very, very suspicious, big picture, as to when you see athletes that you know take meticulous care of their body, not jump on a bandwagon here.
Yeah, although often they want to be paid for that, don't they? So if you want to get they're not athletes, but the Kardashians, you don't get them on board unless you're paying them a vast amount of money for, you know, for example, the migraine pill that one of them is involved in promoting. But I guess one of the issues is here that this is a pretty unprecedented crisis, isn't it? You know, 618,000 people have died from the virus just in the US. We've had 36 million cases, and then it's evolving. So you talked about Provincetown. I think the Delta variant has, you know, everyone thought we were coming back and that we were going to be able to return to some sort of normality. And then this Delta variant starts appearing, which does impact people who've been vaccinated, although not as seriously as those who haven't. So what would your prescription be? Because we've got to do something about this health crisis, because the whole world is still kind of on hold, isn't it? We were all looking at going back to the office in, you know, after Labor Day, trying to work out the different policies so that everyone feels protected, whether you're vaccinated or not. So if you are vaccinated, you don't necessarily want to hang around people who aren't, or if you do, you want to know that they've been tested regularly. What would your prescription be for communicators who are trying to talk to their internal stakeholders and external stakeholders about what's the best thing to do?
It's a really good question. I think the dangerous assumption amongst many was that we were out of the woods and that it wouldn't evolve. And I remember personally thinking several months ago, well, this thing is going to eventually evolve. So we weren't going to be out of the woods. And I think the safest thing, and maybe the most sane thing, was to let everything play out. It's not the answer everyone wants to hear. I think everyone is so obsessed with the short-term line of thinking where what's the quick fix? But I think, you know, there's a rational line of thought of this thing will take its natural course, and it's going to be no different than a hurricane. It's going to be no different than a tornado. It's going to be no different than other natural disasters where you really can't stop it. You can only hope to be very, very vigilant around it. I remember, you know, here things opened up Memorial Day, and we went from 25% capacity at venues to 100%. And yes, there was a mask mandate in place at TD Garden, where the Bruins played a playoff game, the Celtics played a playoff game. But even attending those 2 events with the mask, you still saw it. You know, we had people the next section over in our balcony section, literally throwing stuff at each other because they were pissed drunk. Like, you're not going to create perfect environments. What you can do is you can be as vigilant as possible. And I would say, the way I've lived my life over the last 15 months has been extremely, I would say, cautious, but also realistic. Like, if you can't go and trust the air outside, then we're in much bigger problem. We've got a much bigger problem on our hands than, say, your confidence in terms of walking into a crowded restaurant at this point. And I think everyone's got their own risk assessment. Everyone's got their own pain tolerance. Everyone's got their own, personal idea of what's safe and what's not. And I think the challenge is how to best govern understanding everyone has different risk assessments.
Yeah, I mean, I feel for parents, especially those of young children, because they can get vaccinated, but they don't want to go into a work environment, and they can still be a carrier even when they're vaccinated, and then potentially infect their kids, and that's happening now. So, I feel for everyone, and it's a tough time. I mean, do you mind me asking, are you vaccinated yourself, Jake?
I have 2 or 3 reasons why I'm holding off at this point, and it's not. I guess the thing is like, I can go down the street and get the product if I want to. It's a choice that I have that's easily accessible, which I know doesn't exist in a lot of countries, but you can't undo it. So if there are longer term ramifications, you can't hit an undo or backspace button. So my intention was never to be a beta tester. Now, I don't have children of my own. I am fairly self-sufficient in my community on my own. In my, thankfully, PR is a world where a lot of it can be done digitally and rather seamlessly.
Yeah, we're very lucky in that respect.
Correct. And the other hesitancy I have is I throw big red flags around big pharmaceutical companies getting a lot of legal backing through things like the PrEP Act. And it just, to me, that shows me there's not a lot of confidence in your product if you go out and you want legal immunity. If you go out and you don't want to hold yourself accountable, if you don't want the fine print on your PSAs that we're accountable to with our products, a lot of that has me very, very hesitant as well, at least until, and my thought process was, vaccines started rolling out in January. By August, September, you get a pretty good idea of what was working and what was not. And I think there have been certainly a lot of negatives to go along with some of the positives. And I think even, now I'm probably a little bit more skeptical with Delta in general, knowing, for instance, I think Pfizer's success rate is in the 40 to 60% range. Johnson & Johnson's not had the same success. And, I think that creates more questions than answers.
I mean, we're in a position where the pharma industry acted incredibly quickly to get some vaccines out there. They're authorized, they're not approved. That's correct. Yes. I think when they're fully approved, we'll probably look at it in a slightly different way, but that was a global thing that needed to be addressed, and it was just such a horrific situation. I mean, you have your own run-ins at Iovate with authorities who've had lawsuits around, not declaring things properly. Is one of your beefs that you get treated in a different way to the big pharma companies? Is that where you're, you have an issue here?
I don't know if it's a beef, but I would say dealing with some of the intense measures that we take to avoid similar situations, some of the legal, I wouldn't say battles, but discussions that we have. And our legal team is fantastic, because what they do is they ultimately say, this is what the risk assessment is. Do you feel strongly enough to where it's worth taking that risk? Yes or no? So they do leave it up to us, but the level that we're beholden to the FDA and FTC is very, very high. And to me, that creates a lot of, I wouldn't say our legal department has turned me against the vaccine, but I would say being cognizant of the way we have to advertise and what we can claim and what we can't claim does have me somewhat skeptical, especially if we're seeing on the reverse ends, if you have no legal liability, why wouldn't I invest in Pfizer share? Why wouldn't I invest in Moderna share? Because at some point, the only thing that's going to stop those profits and those revenues and those stock prices are going to be an admission of a product failure, at which point you wouldn't be liable, like say a big tobacco was, or say any other consumer product was. And is it fair? Of course it's not fair. You look at Peloton. Peloton had to pull their treadmill because I think 2 children died on their treadmill, which was a user error, not necessarily a product error. They pulled their entire product line down. So there is a higher bar. Obviously, circumstances are a bit different, but the bars are very different too, and that does create frustration.
Yeah, well, listen, I don't think we're going to solve this in a 15-minute coffee break,
No,
but thank you for joining us, Jake. It's good to chat to you. And yeah, look, one thing we probably all agree on is we hope we get through this soon and that we can return to some sort of normality, because it hasn't been much fun over the last 18 months for anyone. So, yeah.
Yeah. And I think it ultimately comes down to, for a lot of people, this is not placing them or putting them in certain characteristics. I think everyone's got their own different risk assessment principles. And, everyone's got a price too. I think the lotteries have come up and shown that with some minor level of success, that everyone's got a price. And eventually people decide what risk is worth it or isn't worth it for there. But no, I appreciate the platform, and someone go ask LeBron why he's not front and center on this thing.
Well, next time we're chatting, I will ask him. All right. Thank you, Jake. Take care.
Take care.